Can't tell you how many runners I see diagnosed with hip bursitis. They get imaging, get told that's the problem. But most of the time, it's not actually bursitis. And that's a mistake. And that's exactly why their pain keeps coming back. I'm Dr. Ray Peralta, physical therapist and run coach. Over the last 10 years, I've helped hundreds of runners get out of pain, get back to running stronger and faster. This video, I'm going to break down why your hip bursitis might be misdiagnosed, what's actually causing that lateral hip pain, and how to fix it the right way. So misdiagnosed hip bursitis keeps you stuck, right? Lateral hip pain, because if it's just bursitis, you're like, oh, I'm just going to rest, right? It's inflammation. I'm just going to rest for a few weeks, and then the pain's going to go away, right? Wrong. See, 90% of the time, it's not actually hip bursitis. It's actually usually their glute tendon playing like a glute tendinopathy. You could see in this diagram here, and in some other cases, actually be coming from the back. Right. Again, 90% of the time, hip bursitis is misdiagnosed. Right. They'll rely on imaging findings, right? MRI. But the thing is, MRI can show abnormal findings, and asymptomatic folks, pain-free people, will show 73% of the time will show things like labral tears, bursitises, hip impingements, etc. Like all these findings on the hip, yet they're not even in pain, right? So you can't rely on imaging alone to be like, oh, but my MRI showed this, right? Unless it's something catastrophic like a fracture or a tumor or something like that. Many of the times, what's shown in the MRI doesn't always correlate what's the cause, especially when it's hip bursitis. When it's something like hip bursitis, I found that even as a physical therapist, I'm like working with folks, I'm like, no, this looks more like a glute tendon problem. We just got to strengthen your glute, right? The buttock muscle on the side of the hip, as I just showed you. And usually the pain is worsened by things like running, stairs, or just compressing that area where you lie on that side, or sitting too long with the legs crossed or something. And again, the root issue is often glute tendon overload or over compression of the glute tendon versus inflammation of a bursa. Right. And in some cases, it's actually the lower back. About 72% of hip pain is actually coming from the low back. And again, common things that runners who get this type of hip pain will often told, oh, just rest, right? So what happens, right? They'll rest to recover. They have pain. They'll rest to recover. They go, oh, I think I'm good after a few weeks. Maybe a week or 2 or 3 weeks go by. Then they start ramping up the mileage. They start running again, and they have a good day. Oh, I'm going to go a long run. Then they overdo it. Boom, increased pain again. You get in this boom bust pain or injury cycle, or you keep having these recurrent hip pain issue because you actually never fully strengthen the tendon. You just help the pain kind of calm down. And then many folks, they'll go to a physical therapist. They'll do things like cold pack, massage, e-stim, ultrasound, right? Thinking that, oh, that's going to get rid of the pain. Again, you may get some temporary relief. In some cases, you don't even feel anything at all. I've worked with physical therapists almost 10 years. We'll do like the ultrasound. They're like, I didn't feel anything. There's like no effect. And then there are some people who get some temporary relief. But again, it's just kind of dampening or masking the pain. It's not actually fixing the underlying cause, which is usually a loading problem. Like you have to strengthen the glute and the tendon, right? So if you want to copy this Google Doc to learn more about running without hip pain, I'm sharing inside my free school community for runners. Click the link in the description to join. So how I actually fix runners who have like this lateral hip pain, how I help them, overcome this issue, right? Calm their symptoms with whatever the stage of irritability of their tendon is, right? Essentially, I use like a pain traffic light guide. I'll show you later. And here are some sample exercises, and we'll talk about that in a second. But essentially, it's not complete rest. You're not saying, oh, you're going to lay in bed all the time. It's usually, okay, what's the right level of glute activation exercises you can do, or strengthening exercises? Maybe we start with isometrics, right? Like resisted against a TheraBand or against a wall or even against your hand, right? Sometimes it's the sideline hip abduction. You can see here in the image here. Sometimes it's standing lateral band walk. It really depends. That's why I have to do an assessment too. So the problem with when you see social media or videos like this is that you see these exercises. Oh, I'm just going to do all these exercises and it's going to be for me. Slow down, buddy. If you're in pain or an injury, you're not sure what you're doing, it's always best to work with a professional, get it checked out, get an assessment to see what's actually the cause of the pain and see which exercise is appropriate for you. Because although there's a list of exercises I'm showing here, doesn't mean that every single exercise is going to give you the best result, or you may actually overdo it and then flare up your tendon even more. So there is a safe way to pick the right appropriate dosage of the exercise and then safely progress it from there so you actually get stronger. Again, if you don't know what you're doing, which is most of the general public, please work with like a physical therapist, ideally one who works with runners. Anyhow, you do also want to address the load management issues with your programming. So oftentimes many runners will follow up, especially people train for marathons or half marathon. Well, they either do too much too soon or training errors, right? So what happens with a lot of running injuries is just you're doing too much, either too much, it's a load capacity issue, right? You're doing too much mileage, too much speed work or whatever am I having, or even just too many days of the week. So I notice a lot of runners tend to follow plans with having rowing 5 days a week, 6 days a week. And not saying that's necessarily a bad thing. However, I've noticed that a lot of those folks are just not properly recovering between the runs and again in the herp. And that's one of the reasons why I'm a big fan of the 3 runs per week model, where you have more recovery days to allow your body to rest in between, right? You also need to rest and recover from your run workouts. And the problem is when you're doing quote unquote recovery runs, many folks aren't truly recovering. They're running them too hard and they're just adding more stress or load on the body. And then another thing that happens is lifestyle factors that can contribute to these pain or injuries. Like if you have a sedentary job, you're sitting too long, that can actually aggravate the tendon, especially if you're sitting with the legs crossed over, or if you tend to lie on your side when you sleep, that can be an issue as well. So there's lifestyle factors that also can aggravate the tendon that need to be addressed. And then also making sure you're properly fueling, having enough nutrition, getting enough quality sleep so you could actually heal, and then obviously strengthening the tissue so it's actually strong enough to handle the demands of running. Right, so typically we're strengthening the glute med, but even the glute max, the big muscle in the back, your buttock muscle there, right? And train the different movement patterns, squats, lunges, hip thrusters, and then gradually return to run using a run walk program, which I'll show in a moment. But as you can see, the typical progression, like I mentioned, isometrics, then body weight concentric, eccentric movements, whether it's bridges, clamshells, side leg raises, elevated bridges, hip thrusters, single leg hip thruster. Again, there's so many different exercise variations. It's really going to be a case-by-case basis to see where you're at and which this is the appropriate exercise for you. Sample run walk program. For example, this is a very popular method that I would typically do. Like, okay, if you're able to run, right, and it's not for flaring up your pain too much, like you ever do a run walk, then do a run walk. And many runners can oftentimes switch to a run walk method versus continuous running. For example, run for a minute, walk for 2 minutes, or run for a minute, walk for 5 minutes, right? And then do that for 4 sets or 5 sets for anywhere from like 20 to 30 minutes or so. And you can see week by week or every 2 weeks, you'll progress depending on your body's tolerance, your tissue tolerance, and eventually you progress to continuous running, right? Obviously, you always do a proper warm-up, a cool-down, a dynamic warm-up, some stretches, some muscle activation drills as for your cool-down and warm-up as well. And then the pain traffic light, how do you know when it's safe to run? Typically, you're able to walk with no pain. And then when you do a run-walk workout, the pain is very mild. Typically, let's say 3 out of 10 pain or less, and you know, okay, it's in the green light. Now, in some cases, some people will have a higher tolerance. It could go up to like 5 out of 10, like a yellow light. And just use caution if your pain goes to the yellow light. But now if it starts becoming like 7 or greater, like 7, 8, 9, 10 pain, severe pain, right? Obviously don't do the workout at all. Even if the run walk is causing a 7 out of 10 pain, either scale it all the way back and you have to just do run for 10 seconds, walk for 50 seconds or a minute. But in some severe cases, you may actually have to take a whole month off from running if it's that severe. Now, in many cases, it's more mild to moderate, and you can often modify your workout during the run walk method. So what happens when you fix the root cause? Pain starts to decrease instead of constantly flaring up. The glute tendon issue can typically resolve itself within 8 to 12 weeks with the proper exercise program. Again, you just can't rest alone. You do have to properly load it. Now, if you're a bit older, it may take, or you have like other health conditions, obesity, diabetes, it may take a little longer. It may take 16 weeks. It may even take, up to 6 months, like 3 to 6 months, essentially, if you have other medical conditions that are slowing down your healing, or you're a smoker, drinker, etc. But for the most part, if you're relatively healthy, I see many of my athletes, my runners, able to get rid of this in like 8 to 12 weeks when they follow the proper strengthening progression program. And then you get better tolerance for running and daily activities. Break out of that boom-bust injury cycle and return to running stronger and not just pain-free. So I currently have 2 spots open to work with me one-to-one to run pain-free. If you're curious, there's a link to apply in the description. First come, first serve. So what's your takeaway? Most hip bursitis is actually a load management problem, and it's really an issue with the tendon, the glute tendon, or the muscle. Passive treatments don't solve the root problem, right? So stop going, I just need e-stim or laser or ultrasound. The real fix, get a proper assessment, find the right exercises to do, because it doesn't matter which exercise you do, progressively strengthen, and then gradually return to running, and you should be able to go back to training for a half marathon, a full marathon, or whatever distance you want to train for.